First patient.
Hey, Dan, how are you? I'm Dr. O'Brien.
Good, how are you?
Good. So how have you been feeling since our last visit?
Well, besides my head injury, everything's fine.
Okay, great. So I looked over your x-rays and it seems that you have a concussion. From your last visit, you reported that you basically forgot what happened before the accident. Your accident resulted in a retrograde amnesia, a condition in which people cannot remember what happened shortly before their injury. This is most likely due to the fact that were not fully consolidated and that the injury interrupted this process. You understand where I'm coming from?
Yeah, I understand. But will I have trouble remembering things that happened before my head injury? And will I have any memory problems now and in the future?
Well, hopefully this condition will not worsen since you did not get into a severe brain accident and memory trauma was not also severe. So you should be okay. But as an example, people who get into more serious accidents have poor diets or suffer from diseases and are most likely more likely to develop more serious memory issues than what you already have. But everything seems fine and right with you. Just be careful and remember what I told you at your previous visit about not getting involved with physical activities and staying away from TVs for the next several weeks, you know?
Okay, I understand.
Yeah, no problem. But other than that, everything seems good. Take care.
Okay, thank you.
See ya.
Thank you.
Next patient.
Hey, Anne, how are you today?
Good, how are you?
So how have you been feeling?
Overall I've been fine, but I've just been having like short-term memory problems, like remembering what I wanted to do and information.
Okay, that's perfectly normal. Your short-term memory, which is also called your working memory, stores new information briefly and works on that information. We forget short-term memories as a result of decay, displacement, or interference. So decay is when you don't rehearse the information enough, and displacement occurs when new memories replace older ones. And interference happens when old memories interfere with new ones or when the information distorts old memories. So it's not uncommon. No memory disappears from the brain. It's that the brain is unable to access that memory. You follow what I'm saying?
Kind of.
Alright, it's okay. I'll explain more. But there are also ways to help you remember things for short-term periods of time. You can use what they call chunking, okay, which is when you group ideas together into one, and you can use another thing that can help you. It's called rote rehearsal. It's when you go over things more than one time, over and over and over again to help you remember. It won't stick in your long-term memory, but it will do the job for short-term.
Alright.
Okay, other than that, I'm not concerned about you. Just practice what we just went over, and you should be okay.
So, can you, the two techniques?
Okay, rote rehearsal. That's when you go over things over and over and over again to help you
Okay.
remember. You good?
Okay, rote rehearsal.
Yeah.
When you go over things.
Yeah.
Okay.
Okay. All right. Well, I'll see you next time, next visit, okay?
Thank you so much. Have a good
Alright.
day. Oh, where did I park my car?
Next patient.
Oh, hi, Lindsey. How have you been?
I'm okay.
Okay. Well, have you been having any difficulties since the last time I seen you? Or?
Yeah, I've been having trouble remembering things, and
Mhm.
like when I'm in a task, I don't know what I'm doing, and I've been forgetting who people are.
Okay, well, according to my chart here, it says your hippocampus, which is part of the brain, an essential part to long-term memory, it may be experiencing functioning difficulties. This could explain why you're having difficulties recalling memories and remembering. But I must have to ask you, do you know if there's a history of Alzheimer's in your family?
Yeah, my grandmother had it, and my mom has it.
Ah, I see. Okay. So have you had trouble completing daily household tasks, understanding spatial relationships, confusing date and time, or solving problems?
Yeah, I've experienced all of those.
Okay. Although Alzheimer's is not completely hereditary, you may be suffering from it because I see that you're experiencing some of the symptoms. Many sufferers with Alzheimer's lack a sufficient amount of what they call neurotransmitter ACH in the brain. Okay, that deals with motor and memory. I don't want to jump to conclusions or anything like that, and I don't want to scare you. But if we ran a brain scan, we would be able to detect if you had Alzheimer's or, we'll see what's going on. You good with that?
Yeah.
Okay.
So,
Well, before we proceed with the brain scan, I want to reassure you that there are medications to help you treat memory loss and problems with thinking and reasoning and confusion and all that stuff. So you might want to consider doing that too. These medications cannot prevent brain cells from dying and losing connections. They help stabilize the symptoms, okay? Also, 24-hour hotlines for families and sufferers and caregivers can help Alzheimer's patients who experience behavior changes such as aggression, anxiety, and hallucinations. So, you're not in this alone. Do what you have to do. Other than that, it looks like everything else is fine. Blood pressure's fine, eyes are fine, ears are fine. That's it. So, you're good.
Thank you.
All right, we'll check with the nurse and make another appointment.
Okay,
Have a
thank
nice
you.
day.